Dr. Valerie Biousse. I am a professor of ophthalmology and neurology at Emory University in Atlanta. About 2.5 years ago, we implemented a non-mydriatic tabletop hybrid camera, the Maestro2 from Topcon, in our emergency department, which is a very busy general emergency department. The goal of implementation of the camera was to have it completely connected to our ophthalmic PACS system, which is itself connected to our electronic medical record, and to train the ED provider and ED staff to take the pictures themselves for a number of eye problems, neurologic problems, patients with headache, patients with high blood pressure. It is important to have the ED provider take the pictures, because the goal is not to wait for the eye care provider. So you need to spend the time necessary to train them on how to obtain a fundus photograph. Most cameras are very intuitive. The Maestro camera is extremely easy to use. It's almost entirely automated, and that's what you want. It's not intuitive for the ED, it's intuitive for the eye doctors. It is easy for the ED, and that's what matters most. A very common question that people will ask me is, which camera should I buy? It's a very personal response that really is based on what you're going to do with the camera, where you work, what you're expecting. And I think there are a number of very basic concepts that have to be kept in mind. The quality of the imaging you are going to get is directly correlated to the quality of the camera. Patients with acute vision loss often have a retinal vascular ischemic problem. It's really one of the true ocular emergencies, with two goals. One, you want the patient to be immediately diagnosed so that they can be taken care of, have the appropriate workup and the appropriate treatment to prevent a stroke. And two, if you can, you want to be able to administer a treatment that is going to improve the visual outcome. A very important aspect of implementing a new technology anywhere in the field of medicine, particularly in ED, is to show the impact on the ED itself, the flow, the patient's outcome, and the ophthalmology flow. And I think the best description of the impact of the camera is that it has made everything easier. People said, well, if you put a camera in the ED, it's going to replace the eye doctor, and then we're not going to be called to see consults anymore, and it's bad. And not at all. It's not at all the case. It has not taken away any work from us. It has made our life easier.